When you look at harm across the board, I think our greatest success is probably our culture change and just the thought process of, well, that's just a complication that goes with that type of procedure, that goes with that event, and changing that whole mindset to, we can change that and we can reduce that and we can even eliminate that.
Okay, our fall risks today are number 1, 3.
Healthcare tends to become siloed. Nursing does what nursing is expected to do. Pharmacy does what pharmacy is expected to do. And we lose our ability to work together as a team and understand that it takes everyone from start to finish to make sure that patients arrive and go home safely and are well taken care of during their stay.
If we can reduce harm or reduce those instances of things that should not occur, it saves us a lot of money, and it provides much better health care for the citizens of our community.
We started with about a 50% harm rate, looking at all 11 topics through the HEN projects. And where we are now, we've seen about a 50% reduction in overall harm, so we're down in the 20% range across all 11 topics. Where we've seen our most success is in readmissions, surgical site infections, falls and pressure ulcers is making some headway, especially in the last year. Adverse drug events, we've saw a significant decrease there by focusing specifically on each of those projects independently, but also seeing how we could integrate some improvement strategies to make sure that we're addressing several things with one action.
I think about our CAUTI project as an example. We started looking at it, and it was interesting because instead of taking the traditional approach of, well, let's educate our physicians and let's reduce the number of days, we said, let's change the system. Let's really try to hardwire this and make sure that it's a process change. And so they developed a protocol where now the Foley catheter can be removed based on the protocol by the nurse. And that changed significantly. We were able to reduce our CAUTI infections by almost 88%.
Some issues that we deal with, of course, are falls and pressure ulcers, which in our community is a problem because it's a retirement area. And those two items appear at the very top of the sheet every time, and we discuss those at every board meeting. That dashboard is gone over. There's a very lively discussion about some of the issues sometimes, about, we thought we would be here and we're not, or this is much better than we thought it was going to be. What did we do to make it better?
When somebody tells you about a patient and how they suffered because of something, and you know that there is a way to prevent that or possibly prevent it, then you really start to personalize it. And then if you can put the numbers together in an aggregate form so you can see how you're making progress, because if you don't measure something, you can't make improvement. That really makes a difference.
Harm across the board matters because people in the community trust us as a healthcare organization. And we are committed to making sure that we follow through with that trust, that we uphold that trust. And part of that means that we stay committed to making improvements all the time. That one is not none. That as long as there continues to be a surgical site infection or a fall with or without injury in our facility, that we will continue to focus on harm across the board to make sure that we are striving to keep people safe, that people can come into our doors knowing that we're doing everything we can to keep you safe, and that you will be well taken care of when you're at Baxter.